So I hope you have all found these talks pretty inspiring and thought-provoking, and we hope that it'll lead to ongoing collaborations. And clearly, we all recognize this really is an area of unmet need. So, as Dr. de Groot highlighted in his initial remarks, a multidisciplinary approach is really increasingly relevant in the care of these patients. Given the complexities, it's key for expediting patient access to care and for integrating treatment decisions. It's also important in facilitating consistent assessments of molecular tumor signatures for tissue banking that can then inform biomarker development and modeling, as well as clinical trial development. So these are really key. So in recognition of that, over the past year, we've begun to solidify our efforts here at UCSF, and this is a group of us spanning essentially all different divisions and departments, essentially with a joint mission of improving patient outcomes and quality of life through this comprehensive model of care. There we go. So we've really been, as Dr. de Groot again identified, we've been really focusing our efforts in key pillars or key areas, key goals, a multidisciplinary clinical care model that optimizes patient access to resources and integrates treatment decisions, cross-disciplinary clinical trials, many of which you've heard about today, collaborative translational efforts, and a robust biospecimen bank, and also educational opportunities, both within the institution and then outward facing in the community. To date, through regular meetings, we've really concentrated our efforts in these three areas. There is a neuro-oncology presence at PCMB here on Tuesdays, and essentially that's to help coordinate the care of more complex patients. There's a formalized inpatient rounding, co-rounding service with medical oncology, radiation oncology, and neurosurgery that Jen Viner, one of the nurse practitioners in neuro-oncology, has really been heavily involved with. And there's a CNS Metastasis Gamma Knife Tumor Board in collaboration with neurosurgery and radiation oncology. With regards to cross-disciplinary clinical trials, you've heard of some of them today, and we're continuing to try and open additional trials for this particular group of patients, since again, there's kind of that gap here. And you heard about the biospecimen protocol for immune profiling that Michelle Melisko and Laura Huppert have spearheaded, and hopefully that will lead to ongoing fruitful efforts. And then lastly, we're essentially streamlining our biospecimen banking of tissue. Joanna talked about that today. The importance of the brain tumor tissue core has really been critical. And we're working to incorporate a workflow within our consent for CSF banking as well. And right now, all patients who undergo surgical resection for brain metastases, that tissue is getting sequenced through UCSF 500 pretty consistently. In terms of future efforts, again, we're working to build a more formalized multidisciplinary clinic at PCMB, particularly for patients with complex neuro-oncologic needs, for clinical trial coordination, which will become increasingly relevant. And we aim to have an LP or OMIATAP clinic for biospecimen banking, but also potentially for intrathecal chemotherapy administration. There are ongoing efforts for building a robust clinical trial portfolio. And again, we're bridging our basic science and clinical care through ongoing translational research. And Dr. Small talked a little bit about the potential for a CNS metastasis research hub. UCSF already really has the key components with a robust clinical care, essentially, and basic science efforts. But we've identified some gaps in resources in order to grow this program. And these include resources such as a nurse navigator to help streamline our clinical workflow, a dedicated research nurse to effectively and safely enroll and manage patients on clinical trials, lab personnel or a lab technician to expand our biospecimen bank to include CSF, tissue, blood, among other samples, and then a CRC that would coordinate clinical trial and biospecimen bank protocols. We have completed a pro forma analysis looking at profit margins for patients with brain metastases, and we know this is financially feasible and it's a self-sustaining endeavor. And in neuro-oncology alone, we see approximately 150 new patients with CNS metastatic disease. Most of those patients are retained within UCSF for subsequent care, including surgery, radiation, infusions, imaging. And essentially, in order to move this forward, we do require institutional support for the personnel to establish this important programmatic effort, with the understanding that this is a program that would really serve an important area of unmet need within the institution and the community. And with this support and through ongoing collaborative efforts, we really envision UCSF serving as a leading CNS metastasis program through clinical excellence and innovation, both in clinical and translational research, with a vision of essentially advancing the treatment, early detection, and prevention of tumors metastatic to the central nervous system. So with that, I'd like to thank everyone for their attention and for their time here today. We will have lunch, and we hope some of you will stay, and the goal is to continue this conversation.